In tonight's Health Watch, new help and hope for patients with heart failure.
The FDA has recently approved a medical device that's giving those patients a second chance. CBS News' Dr. Max Gomez is here to show us how a New York man got his life back. Max.
That's right. And you know, believe it or not, heart failure is one of the fastest growing kinds of heart disease right now. That's at least partly because doctors have gotten so much better at saving heart attack victims. But when a heart attack damages heart muscle, the rest of the heart has to work extra hard, and that can eventually lead to failure. When 72-year-old Woody Manzer moves around his house, he's tethered to a battery that sits on the floor of his living room. It's his lifeline. It powers his heart. Just 2 years ago, Manzer was in heart failure.
Don't remember it, but I guess I almost died. They said my heart function was down to less than 25%.
He needed a heart transplant, but his older age made him ineligible for one. So his doctor, Milana Yusufpolskaya from New York Presbyterian Columbia, recommended a medical device called an LVAD. The device is attached to the left ventricle and aorta of a patient's heart to help pump blood to compensate for the weak and failing heart. The power cord for the pump snakes through the body and out a port in the belly.
Once you reach advanced heart failure stages, the survival at 1 or 2 years is pretty poor. The LVAD has changed that completely. What the trial showed is that survival is over 75% at 2 years in these patients who otherwise would have not fared so well.
The FDA has now approved the LVAD for long-term use.
We have patients on the original pump for 8 years, and over 50% of our patients make it beyond 5-year mark.
Patients have to be extra careful of infection at the port site, and when Manzer leaves a house, he wears batteries weighing 7 pounds and carries an extra set just in case. But he says it's all worth it.
Definitely a second lease on life for me.
He spent much of the last 2 years traveling with his family, making every moment count. Now, LVAD, which stands for Left Ventricular Assist Device, has been approved, but had been approved as a temporary bridge while the patient waited for a heart transplant. But as we know, there aren't enough hearts to go around, even for younger patients who would qualify. Now, this LVAD can be used as a permanent heart assist device so that, you know, if you're too old, you're too sick or whatever, and you can't get a heart or you can't get a heart in time, this keeps you going.
Absolutely incredible.
And it's also now available for there's a different one that's available for the right ventricle. That's a little less common, but that'll help pump blood through the lungs.
Wow.
Okay, so a device bringing a lot of hope to a lot of people.
We sure hope so.
You got it.
Thank you,
All right, thanks,
Dr.
Max.
Max.